everyone, Dr. Mia here from ProFysio Physical Therapy. Okay, so you hurt your back. What's next? According to a Mayo Clinic study done in 2013, low back pain ranks in the top 5 for reasons people seek medical attention. Low back pain can be annoying, persistent, debilitating, and can ultimately severely limit someone's quality of life. In this video, we're going to go through some common causes and mechanisms of low back pain, how to try to differentiate what your symptoms mean, and what you can do on your own before seeking medical help.
Low back pain is commonly categorized into 2 broad subsets, being chronic and acute. Chronic low back pain is usually defined as having lasted longer than 6 months. Some of the symptoms can be moderate and on and off, and some of the causes can be arthritis, degeneration, normal wear and tear, and prolonged poor posture. Acute low back pain, which will be the focus going forward, can be defined as lasting less than 2 weeks, associated with a specific injury, or sudden insidious pain where there was no pain before. The ER should be considered whenever there's life-threatening scenarios happening. So this can include falls from a moderate height, and that's accompanied by severe pain, numbness and tingling through the genital region, and any kind of bladder or bowel dysfunction. A few of the main reasons to visit the ER would be to rule out severe fractures or conditions such as cauda equina syndrome, which results from compression or severance of the post-spinal column nerves that supply the sensation and function of the bowel and bladder region and can lead to prolonged or permanent paralysis. Some of the less severe causes can be due to simple injuries leading to muscle strains, mechanical joint dysfunctions, or disc pathologies. These injuries can be as simple as bending over suddenly to pick something up, which can strain some of the supporting muscles. One of these is the quadratus lumborum, which attaches from the top of the hip bone to the vertebrae and ribs. Sudden and awkward movements can cause joints known as facets, which join vertebral bodies to lock up, be inflamed, and eventually painful. Another common joint that can cause pain is known as the sacroiliac or SI joint, which joins the sacrum with the hip bone. This joint is often injured with awkward step downs from a curve or repetitive movements such as running. It'll usually reproduce a painful area right at the belt line. Injuries can also be caused due to lifting weights with improper form, causing harm to the discs, which provide support and cushioning between the vertebral bodies. These discs can be injured in the form of protrusion or bulging, where the inner more gelatinous material push out against the outer supportive ring, or herniation, which includes extrusion, where this material can break through the outer disc but still stay within the disc, or sequestration, where it is completely separated from the disc. These pathologies then can push against the nerve roots and cause peripheral neurologic symptoms. These symptoms can vary from burning pain, tingling, numbness, weakness, and present throughout the legs in various locations. An easy test to see if your symptoms are nerve or disc related is the slump test. The slump test can be performed by slumping forward, straightening the leg, bending the neck forward, and pointing the toes towards your head. A positive slump test will increase the pain in your back or increase numbness and tingling down the leg, whether it's in the front or the back. Muscle strains or joint pains can present as a painful spot in a single place that is reproduced with certain specific movements. And unlike nerve pain, it normally does not travel down the legs, and there is usually no numbness and tingling involved. Heating pads or ice packs can also be a great source of pain relief. Heating pads usually work better with tightness, dull aches, and spasms, while ice has more relief for sharp pains and swelling.